Hello, my name is Christensen, and this is my physical assessment video project for 60/20 Advanced Health and Physical Assessment. So I'm going to go ahead and get started. I'm going to come into the room and just wash my hands first and greet my patient. Hello, Mr. Krieger, how are you today?
I am doing good. How about yourself?
I'm good, thank you for asking. I am Christina. I'm going to be the nurse practitioner student that will be doing your physical assessment today.
Okay.
Do you give us consent to video this and send it to my professor for grading?
Absolutely.
Okay, great, thank you. Before this, we went ahead and did a Snellen chart, which was right outside the room. The patient has 20/20 visual acuity. The MA did his vital signs 118/72, heart rate was 62, respirations were 18, pulse ox was 99% on room air. His height is 6'2", weight is 250, BMI is 32. The patient generalized is alert. The patient is oriented. He appears to be his stated age. He appears to be well nourished. He's in no acute distress. I'm gonna first just assess his skin, and I'm looking at it here. His skin is pink, it's warm, it's dry. I don't see any lesions or obvious wounds. I'm gonna go ahead and just assess his head. I'm going to look for symmetry. All right, everything's symmetrical. I'm going to go ahead and just palpate his head. And I don't feel any indentations, I don't feel any masses. His hair is well distributed, his hair is thick. All right, very good. I'm going to now assess the patient's face. I'm again looking for symmetry. His eyes appear symmetrical, his ears are symmetrical, nares and mouth are symmetrical. I'm going to go ahead and palpate your face now. Let me know if you feel any tenderness when I palpate. Palpating his frontal sinuses, his maxillary sinuses. All right, very good.
No tenderness.
Great, thank you. And while I'm here, I'm just going to feel for his temporal pulses. I'm going to make sure that they are equally strong, good pulses, very good. Temporal pulses are equal. I'm going to kind of feel down the jaw, assess for TMJ. Go ahead and open your mouth and close your mouth real big. Good, I don't feel any clicks. Any tenderness when you do that?
No.
Okay, great. I'm gonna have you look right at me and I want you to smile real big. Awesome, good. Go ahead and raise your eyebrows up. Good, and then I want you to puff your cheeks out. Good, and then clench your jaw. Let me see your teeth. Good, awesome. And then while we're here, I'm gonna have the patient stick out their tongue. Go ahead and stick your tongue out. Good, tongue is midline, very good. All movement is done with ease and all movement is symmetrical. I'm now going to move on to assessing the patient's vision and eyes. First, I'm going to just take a look at the structure of the eyes. His pupils are equal. They appear to be about 5 millimeters in diameter. There's no abnormal redness. The sclera looks clear. The conjunctiva looks white. So first I'm going to go ahead, I'm going to take my finger, I'm going to come in from this side. I want you to tell me when you see my finger, okay? Go ahead.
That's it.
Awesome. This side?
That's it.
Very good. And now I'm going to go ahead and check the 6 cardinal fields. I want you to follow my finger. Follow it this way. Good. And up and down. Back to the middle. Good. Follow this way. Up. Good. Perfect. Again, ease of movement, no nystagmus noted. I'm now going to go ahead and assess the patient's pupils. All right. I'm going to shine this light in your eyes. Just go ahead and look straight at me. Good. And I'm noticing both direct accommodation and consensual accommodation. Again, one more time. Good. Good. Nice brisk pupil reactions. I'm gonna go ahead and I'm gonna bring my finger towards your nose. I want you to follow my finger with your gaze. Good, perfect. Accommodation, pupils, accommodation. Oh, I see this. I'm gonna go ahead and assess your eyeball now, the inside of your eye. I'm gonna go ahead and look through here. I'm gonna note the red reflex. And then I'm gonna go ahead and just kind of come in here. Good. Until I do see the optic nerve. I see vessels. I see the optic cup. Cup to disc ratio looks good. No signs of hemorrhage. All right, great. I'm gonna do the other eye. Sorry. Okay. Reflex, there it is. Awesome. Okay, great. Looks great too. Okay, now I'm going to go ahead and assess the external structure of the patient's ears. Checking the auricles, the pinna, feeling for any tenderness, any inflammation. I don't feel anything there. Does that feel tender at all if I tug just a little bit on your ears? Okay, great. I'm going to go ahead and assess the inner structure of the ears. All right, turn your head that way just a little bit. And down. All right, good. I visualize the canal, which looks clear. No redness. I visualize the tympanic membrane, which looks pearly. No bulging. Again, no redness. Great, and again, canal is clear, tympanic membrane looks pearly, no redness or swelling. Okay, great. Now I'm gonna go ahead and just check your nerves for patency. Good. All right, good. And can you open your mouth for me? Stick your tongue out. Good, uvula is midline. Tonsils are absent. No redness, no swelling. Go ahead and stick your tongue out again and then swallow. Any issue swallowing?
No.
No, okay, perfect. The patient is well denturated. I'm now going to go ahead and just assess your neck. So I'm going to come here and just kind of feel your lymph nodes. Pre-auricle, post-auricle, occipital, clavicular. Okay, any swelling? Any tenderness when I do that?
No.
When I push here?
No.
Okay, very good. I'm gonna just take a look there at the neck, just make sure everything looks symmetrical. I had the patient swallow just to make sure that thyroid looked midline. I'm going to assess your thyroid from behind. You can just stick right there. Okay, there we go. Good. Thyroid is normal size. I don't feel any nodes or nodules. No goiter noted. Awesome. Okay. Go ahead now and listen to your neck. I'm going to check the carotid arteries. Look up for me just a little bit. Good. Good. No brewery noted there on the right carotid. Okay, good. And then for the purposes of this video, we're going to pretend like the patient's shirt is off, but the patient wishes to keep their shirt on. We're going to pretend like it's off. So I'm going to go ahead and just observe the shoulders. I'm going to palpate the shoulders. Feel for any deformity, any tenderness, any masses, any swelling. All right, good. And then I'm going to go ahead and move on to the cardiac assessment. And I'm going to first visualize the chest. I'm going to look for any like heaves, any pulsations. I'm looking for any masses, any impressions, and I don't see any of that there. So now I'm going to go ahead and auscultate the heart sounds. And first I'm going to listen to the valves. First I'm going to listen to the aortic valve. Pulmonic valve. Tricuspid valve. And the mitral valve. Good. I'm going to note the point of maximal impulse. Point of maximal impulse is in the 7th intercostal space, mid-clavicular line. And now I'm just going to go ahead and listen to your heart, noting the rate and rhythm. S1, S2 is present. No S3 or S4 noted, no murmurs, no clicks, no rubs. Okay, great. And then now I'm just going to go ahead and take a look at your hands here. I'm going to feel for the radial pulses. Equal. I'm going to check brachial pulses. Okay. Those are equal. Awesome. Now I'm going to go ahead and assess his respiratory status. I'm going to first just again visualize the chest. Noting respiratory rate, respiratory effort. The patient is not making any extra effort to breathe. Respiratory rate is regular. I'm going to look for any accessory muscle use. I'm going to check AP diameter of the chest. I don't see any obvious signs of barrel chest. So then I'm going to go ahead and just kind of feel the chest. I'm going to palpate, again, just for any lumps, lesions, or tenderness. Anything?
No.
Okay. Very good. I'm going to go ahead and auscultate. Nice deep breath in and out. Good. Again. Good. Again. Good. And then I'm going to test tactile fremitus. I'm going to take my hand like this, and I'm going to ask you to repeat the words 99.
99, 99, 99, 99, 99.
Good. Okay. Awesome. I'm now going to move on to the posterior part of the back. Again, I'm going to just inspect the back here of the chest, and again looking for masses. Any kind of obvious sign of dyspnea or and I'm going to go ahead and test expansion of the chest. So I'm going to go ahead and bring my hands down like this at the 10th rib. I'm going to bring my thumbs together, and I want you to go ahead and take a nice deep breath in. Good, and out. Good. I'm just testing for equal and symmetrical chest expansion, which there was. I'm going to go ahead and take a listen now. We're going to listen to bronchial, vesicular, and vesicular breath sounds. Good. Good. And then again, I'm I'm just gonna have you repeat the words 99,
99, 99, 99, 99, 99, 99.
Good, okay, perfect. I'm gonna go ahead and just percuss the fields back here. Okay, great. All right, so now we're gonna move on to your abdomen. If you could go ahead and lie down for me. So first I'm going to, I'm actually gonna put your head down a little bit. Is that okay?
Yep.
Okay. I'm gonna go ahead first and inspect the abdomen. I'm looking again for pulsations. I'm looking for ecchymosis. I'm looking for any spider veins. So I'm gonna go ahead and just take a look at that. Everything, I don't notice any of those things, some minor scarring. All right, very good. And then I'm going to go ahead and auscultate breath sounds, bowel sounds. Bowel sounds are present in all four abdominal quadrants. And then while I'm here, I'm also gonna auscultate the abdominal aorta for any bruits. None noted. I'm going to auscultate the renal arteries. The iliac arteries. And the femoral arteries. Okay, no bruits are heard. So now I am going to percuss the abdomen. I'm going to check for liver span and liver edge. Okay, looks like there's our liver edge there. Kind of come across this way. Okay, and I'm going to go ahead and percuss the spleen. Okay, no hepatomegaly and no splenomegaly is noted on percussion. I'm going to, while I'm here, also just percuss the bladder. And now I'm going to go ahead and palpate the abdomen. First, I'm going to do some light palpation. Make sure the patient doesn't have any significant tenderness. Again, checking for masses, locating. Does that feel okay?
Mm-hmm.
All right, and now we're going to go ahead and do some deep palpation. Good. Does that feel all right?
Yep.
Okay, good. All right, good. And then while we're here, we're going to go ahead and do a psoas test and a obturator test. So the first thing I'm going to have you do is I'm going to have you lift your right leg up against my restraint. Good. Any tenderness noted right here in
Nope.
the right side? Okay, perfect. And then I'm going to have you flex your knee up like that. And then bring your knee forward and your foot this way. Good, perfect. Any pain or anything like that there?
Nope.
Okay, awesome. I'm going to, while I'm here, I'm just going to go ahead and just palpate the patient's hips. Again, looking for any deformities, any tenderness, masses, looking for edema. All right, very good. And then I'm also just going to feel the femoral pulse as well in here. Okay, good. And then while I have the patient in this position, I'm just going to go ahead and assess their legs as well. I'm assessing their skin. I'm assessing hair distribution. Skin is not too taut. Hair is well placed and distributed. I'm going to go ahead and just feel for any edema, tibial edema, ankle edema, or pedal edema. Okay, good. I'm going to feel for popliteal pulses. Good. Okay, good. I'm going to feel post-tibial pulses. Make sure they're equal. Pulses are strong bilaterally. +2 pulses, and then pedal pulses. Very good. And then while I have the patient here, I'm also just going to check the Babinski reflex. Lift your foot up. All right, good. All right, very good. So now, one more thing. I'm going to test the patient's sensation. So go ahead and close your eyes for me, and I'm either going to touch your leg with a sharper edge or a soft edge. So you tell me if it's soft or sharp, okay?
Soft.
Good.
Hard.
Good.
Soft. Hard. Soft. Hard.
Good.
Hard. Hard. Hard.
Good. Okay, perfect. We're going to head into that. Now I'm going to have you sit up again on the edge of the bed. Go ahead and do me a favor, shrug your shoulders up, bring them down. Good, do it again with my restraint there. Good, all right, perfect. Now, since the patient's back in this position, I'm going to go ahead and perform the Rhinen-Weber test to check for hearing loss. So first thing I'm going to do is I'm going to strike this. I'm going to place it on top of your head, and you go ahead and tell me in which ear you hear it the loudest, okay?
Gotcha.
Your right ear. Okay, so right here. I'm going to put this over here. Tell me when you stop hearing.
Stop.
Okay, and do you hear that now?
Yep.
Okay, good. And now we're going to go on to this side. Place that there on the mastoid bone. Tell me when you stop hearing
Stop.
it. Okay.
Yep.
Okay, very good. I'm now going to go ahead and check the patient's reflexes. So I'm going to start with the bicep reflex. So go ahead and just relax your arm down. I'm going to put my thumb here. And I'm going to go ahead and hit. Good. Good. Go ahead and do it on this side. Okay. Brachioradialis reflex. Relax your arm. Good. Good, okay. And now I'm going to try to, you're really tall. Bring your legs back just a little bit for me so they're dangling. Okay, we're gonna check patellar reflexes. Ooh, that was a good one. And then Achilles reflex. Okay, and triceps. So what I'm gonna have you do is I'm gonna have you bend your elbow, bring it up and relax it. Good. Good. And again on this side, relax your arm. Okay, awesome. Very good. And now we're gonna test range of motion and musculoskeletal strength. So first we're gonna assess the range of motion of your neck. So I want you to look to your right, look to your left. Good, look up, look down. Can you bring your right ear to your right shoulder? Left ear to your left shoulder? Good, how does all that feel?
Good.
Feels good, okay, good. Now I'm gonna have you go ahead and just extend your arms out, bring them to the side, bring them back in, bring them up. Good, bring them back down, rotate. Good, any issues with that?
No.
Good, good, full range of motion there. And now I'm gonna have you stand up. And I'm going to have you bend down. Good, okay, up. Go ahead and twist to your right. Good, twist to your left. Can you bring your right knee up? Left knee up. Good, awesome. And now I'm gonna have you walk heel toe, starting from that corner over there. Don't hit your head. Okay, great. No ataxia noted. Patient has full range of motion throughout all of his joints. And Mr. Krieger, I so appreciate you letting me do my assessment on you today. That's my assessment. Thank you.